I'm Tony Coppolino, Fire Chief in the City of Fountain Valley, and I represent all fire departments in Orange County through the Orange County Fire Chiefs Association. All of you are aware of the many issues in our healthcare system. We are taking action to improve it. The Orange County Fire Chiefs have been approved to conduct a study through the pilot program in integrated healthcare, better known as community paramedicine. Utilizing our existing resources in emergency medical care, we will redefine the role of paramedics to triage low acuity patients and offer an alternative destination for ambulances to transport those patients for further medical care. Providing the patients a choice of where to be treated is not available today. Our pilot program will prove that low acuity patients can receive medical care from alternative destinations such as urgent care clinics, and that there is a benefit to the patient, the healthcare system, and first responders. Today I'm joined by my colleagues and community partners to share information about our pilot study. Under the leadership of Dr. Howard Backer, Director of the California Emergency Medical Services Authority, and Dr. Sam Stratton, Director of the Orange County Emergency Medical Services Authority, paramedics from the cities of Fountain Valley, Huntington Beach, and Newport Beach will receive specialized training to function outside their customary emergency response and transport roles in a way that facilitates a more appropriate use of emergency medical resources. Select paramedics will receive specialized training in patient triage and medical protocol to determine if patients with low acuity medical conditions can be transported to an urgent care medical clinic.
The EMS Authority is testing a new concept of using paramedics to assist in the integration of healthcare to the citizens of this fine state. One of those projects include transporting patients to other than emergency rooms when it is appropriate to meet their needs. This is the combined focus of the Fountain Valley, the Newport Beach, and Huntington Beach fire departments.
The fire service in Orange County delivers the highest degree of emergency medical care. However, we are faced with dynamic changes in pre-hospital care, some brought by presidential initiative, and some by increasing burden on the existing facilities and programs. Innovation is second nature to the fire service, which compels fire chiefs to find ways to service our community efficiently and effectively, while being fiscally responsible. We have developed a team of healthcare providers to facilitate and administer our alternate destination study.
Our citizens and the visitors to our communities are extremely fortunate in that should they ever need emergency medical services, Orange County has one of the best pre-hospital care systems that you will find anywhere in the country. The community partners who have joined the Orange County Fire Chiefs Association and our 3 cities in this project include St. Joseph Hoag Health, which is Hoag Hospital, Newport Beach, Hoag Hospital, Irvine, and Hoag Urgent Care in Huntington Beach, Kaiser Permanente Irvine Medical Center, Memorial Care, which includes Orange Coast Memorial and Memorial Care Medical Group Urgent Care Center, Family Care Center, which includes Hoag Urgent Care Newport Beach, Care Ambulance Service, and the Orange County chapter of the California Emergency Nurses Association. The Orange County Emergency Medical Services Agency is a true leader in our community.
The healthcare agency is proud to be involved and a participant in the Alternate Destination Community Paramedicine Pilot Project. This project is very innovative and will affect emergency medical services not only in Orange County but throughout the state of California, allowing for the transport of emergency patients to high-functioning or urgent care centers that can provide fast, effective, and cost-effective medical care for those people calling 911 who are eligible for transport to these urgent care centers.
The University of California, Irvine Center for Disaster Medical Services is also a key partner in this project.
The Alternate Destination Pilot Project and the Community Paramedicine Pilot Project for the state was actually developed in response to a growing awareness that over 20% of EMS ambulance transports that result from a call to 911 are for presentations or medical complaints that could be treated or cared for in a location outside of an emergency department. We hope to evaluate approximately 400 patients, can our paramedics, who have been trained in advanced practice evaluation for specific low acuity complaints, make safe decisions and recommendations to patients as to where they can be seen, whether they should be seen in an emergency department or whether they can be seen in an alternate destination, in this case in urgent care clinics.
We're also partnered in this effort with the Hoag Hospital Foundation, which has provided important financial support to the project.
We have discussed the critical importance of the collaborative effort from each partner involved within this pilot study and recognize the significant effort everyone has committed to the success of the project to this point. Financially supporting any type of pilot project is challenging. We are lucky to have obtained sponsors to offset the project's cost, which reduces taxpayer impact.
One of the problems we face in developing a pilot project is how do we fund it? How do we get contributions? How do we get the money to pay for the people that are impacted? In order to do that, we had to develop the importance of the study to the community and the value to the healthcare system. Once we determined that value and the importance of the project, it was fairly easy to get some community partnership help. Our agencies have contributed staff, hundreds of hours of staff work. Also, we have people at the 5 urgent care centers that have contributed time, as well as many, many hours by our researcher at the University of California, Irvine. But we still need money. We need approximately $272,000 over 2 to 3 years to provide for the minimal cost of this program. So we looked for our community partners, and Hoag Community Benefits Program stepped up and made significant contributions to this project, as well as the California Healthcare Foundation, and we are still looking for funds to offset the cost of this program.
You can't do a project of this magnitude without addressing patient safety. Quality patient care is our primary concern, and it's always at the top of our priority list. Every aspect of this project, including the advanced level training for the paramedics and the medical protocols, have gone through multiple levels of approval. We have successfully prepared 26 paramedics. They all have received 16 hours of advanced education during the past months. They will also continue to receive periodic refresher courses throughout the 2-year implementation phase. The medical protocols that were approved addresses several things. The field procedures for the paramedics and what they're expected to do in the field. We identify the specific criteria for selecting which patient conditions would be appropriate for transport to the urgent care centers. Then we also have the guidelines that the urgent care centers must follow in order to participate.
It was my privilege to be a part of the original planning and implementation of a trauma and paramedic system in Orange County decades ago. Because of that, having been a resident of Orange County for 40 years, I followed the development of the paramedic services and really am astounded of how technology and medical practice has improved. Paramedics are performing procedures on-site in the vehicles that normally would have been conducted in the emergency room, and it has been a terrific advance. I'm looking forward to seeing the results of this study and hoping to move forward with a system that can even improve paramedic services to a greater extent than we've currently enjoyed.
In order for this community paramedicine pilot study to be successful, it was recognized early on that participation of our various stakeholders would be essential. Essential to designing the study, essential to developing the protocols and procedures, to caring for our patients, to developing and analyzing the data, and creating a study report that was both scientifically and medically sound.
The healthcare agency believes that this program is extremely safe. It will be closely monitored for patient safety and effectiveness, and we are proud to be participants in this project.
We'll be following all of these patients to see what their outcomes were, regardless of where they went, and to see whether or not those paramedics made safe and appropriate decisions.
It is our hope that the public and the medical community feels confident in our commitment to patient safety.
One would ask, why did we select alternative destinations for our pilot project? The answer is simple: patient choice. Right now, patients do not have a choice. We must take them to an emergency department. Therefore, taking those low acuity patients to an urgent care center will improve the healthcare system.
On behalf of Dr. Backer, I would like to congratulate these 3 departments, their city leadership, the community paramedics for their willingness to implement the vision of this very important project.
Adapting to the changing needs of the community is the primary goal of the Orange County Fire Chiefs Association, and we accomplish that through pilot studies such as this one. As you heard, a significant amount of effort was exhausted in the last 2 years preparing for the Alternate Destination Pilot Project. That effort was collaborated by a group of people from both the private and public healthcare systems that have a passion to improve the pre-hospital care system, and in doing so are committed to ensuring a safe, high level of medical care. The Orange County Fire Chiefs' desire is to support the Institute for Healthcare Improvement's triple aim. 1. Improving the patient experience of care, including quality and satisfaction. 2. Improving the health of the population. And 3. Reducing the per capita cost of healthcare. We believe the outcome of this pilot study will not only support the triple aim, but will also provide people with healthcare options that make sense, are safe, and efficient. Thank you for joining us.